lack of sexual interest in females and lack of sexual arousal in females. In which medical condition do we see this? Let's talk about this topic in this video. I am Dr. Praveen Tripathi. I am a consultant psychiatrist and sexual disorder specialist. So often we talk about male sexual health problems, but rarely we discuss female sexual health problems, which is unfortunate because as medical professionals we should be talking about both the sexual problems faced by both men as well as women. So to correct that, to rectify that mistake of ours, we are starting with a series where we talk about female sexual health problems, and in this video we are talking about a particular disorder which is called as female sexual interest / arousal disorder. As the name suggests, the primary problem is either of interest or the sexual arousal. So when do we say that a particular female has this condition? Now before talking about the symptoms, I want to bring this to your notice that it is a very common problem. Especially lack of desire in women is considered to be the most common sexual disorder in women, and the prevalence is pretty high. Various studies have been done in different countries, and the results show us that almost 25 to 40 to 45% of women have this issue. So it's a huge number, 20 to 45%, almost 1 in 4 to 1 in 2 women have this problem, and it is across the countries, across the cultures. And these conditions are rarely taken care of. They are often neglected, which causes a lot of disturbance to the women in particular and the couple in general. So what are the symptoms of this clinical condition? So there are 6 symptoms that are defined. The first is lack of sexual interest, lack of interest for sexual activity. So the woman does not feel like engaging in sexual activity most of the time. Rarely it happens that she would have interest in sexual activity, but most of the times she does not have any interest in the sexual activity. Not only that, the second symptom is there is significant lack of thoughts about sexual activity. The woman does not even get thoughts about sexual activity. There is lack of fantasies. Third is the woman rarely initiates sexual activity on her own, and if her partner initiates a sexual activity, she does not really respond to it. So on her own, the initiation is almost never there, and even if the partner is initiating it, the reciprocity to that initiation is also lacking. Fourth is during the sexual activity, the woman is not able to enjoy it. There is lack of pleasure in sexual activity, which further acts as a deterrent to future sexual activities, because if you are not enjoying something, of course you would not want to indulge in that later on. This is the fourth symptom. The fifth symptom is during sexual activity there is lack of sensations in the genitals. Pleasurable sensations are not there during the sexual activity. And lastly, there is very poor responsiveness to sexual cues. What do I mean by that? If there is some porn movie going on, or some kind of erotic literature is there, even reading that literature or watching that movie does not really cause arousal. So these are the 6 symptoms for female sexual interest arousal disorder, and the criteria is that if out of these 6, 3 are present, then there is a likelihood of the person having this disorder. Just the presence of symptom is not enough, because what we see is that in many women there are periods in life when sexual activity takes a backseat, and if these symptoms have been continuing for at least 6 months, only then we can call it a disorder. Otherwise we just call it a temporary phase. So 3 out of those 6 symptoms must continue for at least 6 months. There is more to the definition or more to the criteria. Apart from the symptoms and the duration, the symptoms should be causing distress to the women. That is the third important part of the definition. So we are talking about 3 things here. Symptoms are there for more than 6 months and causing significant distress. Only then we diagnose female sexual interest / arousal disorder. Another important point to be noted is that generally speaking, the sexual desire in men is comparatively more than it is in females. So if there is a couple where men has higher sexual desire and the women has comparatively lower sexual desire, that does not mean that the women has a problem, has a sexual disorder just on the basis of that. Just the discrepancy between the desire is not enough to make a diagnosis. And to make a diagnosis, as I mentioned earlier, symptoms, duration and distress must be present. So it is important to identify these symptoms. If they are present, you must talk to your doctor, you must meet your psychiatrist or gynecologist and get evaluated, because the treatment is possible now. There are ways how these things can be managed, and there is no reason why female sexual health should not be given enough importance, or importance as much as it is given to male sexual health. So friends, this platform of MeSolves has been created to disseminate information about the sexual problems and sexual health in general. And if you like this kind of content, you can definitely join us. Thank you.